The reason why we have to straighten teeth is to make another word, to make a contact points besides the aesthetics and beauty, to contact point. The cephalometric interpretation. What have we left behind from the cephalometric tracing since we started to use it? And I found this is the Japanese ortho waves in the Japanese board case. And this is the cephalometric tracing used by presented to the board case. And this trace, the trace of hard tissue such as the mastoid process, occipital condyle, and the condyle head, coronoid process, and some of soft tissues, nasal cavity, soft palate, tongue, and adenoid and tonsil, and are not shorn. I think if we take cephalometrics, not to take just a point and the lines, should we get more information from one cephalometrics? This is I took the board case from Eiichiro 2002. And this is the tracing presented to the board case. And a large ear rod masked some important, this is a very large ear rod, and important anatomical points. Posterior borders of mandible are largely shifted to both sides on the head film, but the same result is not shown in the tracing. If we found this much of big shift posterior border mandible, might have something problem on the TMJ area. And this ear rod little shift off. But so we have to examine the maybe once or twice a year to take a cephalometric apparatus to have to get together the same ring. Otherwise, the cephalometric apparatus is sometimes shifted. So this is also, I took the board case of Eiichiro 2004. See, can you see it? There is a continuous line from the an occipital bone to the posterior arch of the atlas. Here's a continuous line. But there is no trace on the complete cervical vertebra. If, this is very interesting, if there is the connected with the occipital bone and the posterior arch of the atlas, we can't move the legs anywhere. See, we're locked. So I think better to consider about the very clearly, severely to trace to the anatomical or functional or things. So this is one of the ideal anatomical tracing done by Dr. Miyashita, Kuni Miyashita. He is a graduate from UCLA and now in practice in Tokyo, and his Now he's giving a lecture at the eastern part of the university, 5 or 6 university, Case Western University, and he's #1 cephalometric tracing. And look at see, this is occipital bone in the mastoid bone here. Here's a line in the cranial, and this the atlas should be has a attached, and a soft palate adenoid may have a tonsil and a tongue, and there's a lower concha of and little concha in the airway, and so we can see anything from the one cephalometric X-rays to get more information, not only points and angles, and that's it. That's too wasted. We should take more information. So trace by your hands before to send to the PC. So not just on the PC.